Hello and welcome to the debate on Sky News. I'm Martin Stanford. Here's our take on developments brought together from America, the UK and around the world. Obamacare marches on for a third year and becomes a campaign issue. But is the landmark health reform working? Also, the legacy of terror, empty resorts, frightened holidaymakers, a country losing confidence. We speak to the Tunisian tourist minister. Has it worked? Obamacare, the Affordable Care Act, is now in its third year, and healthcare is likely to be high on the agenda as the presidential election is now just 1 year away. So, should it be enhanced or scrapped? Well, as usual, the Democrat commentator Jeffrey Robinson is standing by in New York, and the Conservative commentator Armstrong Williams is in Washington. Jeffrey, what do we do with Obamacare?
Well, first of all, you enhance it, and you pay no attention whatsoever to the Republicans and their spurious arguments, because none of them make sense, and most of them are simply not true. To repeal Obamacare now would cost 24 million people their health insurance. That's a sin. The Obamacare is not the reason that healthcare costs are rising. It's that healthcare costs are rising, and therefore the price of Obamacare or the Affordable Care Act, when people buy it in the marketplace, will go up again this year. But the increase, which I think the Congressional Budget Office said this week, will be about 7.5% or 7.25%, something like that, and not the 30, 40, 50% that the Republicans are claiming. That increase is less than it would have been without Obamacare. Again, healthcare costs are rising. Interesting thing I stumbled across this morning. In 2011, the congressional Democrats proposed to the congressional Republicans that if you want to repeal the Affordable Care Act, you should lose the same benefits you now enjoy with congressional insurance, the same benefits they would be taking away from the rest of the country. Such as 26-year-olds, up to 26, your children would be included, pre-existing conditions, all of that sort of thing. And none of the Republicans would go for it. It's all right to screw the American people, but they're not going to screw themselves out of health care.
Well, let's ask Armstrong, shall we, what he would do right now. Armstrong, would you change it or would you scrap it altogether?
Well, more options really signals more complicated coverage. Sort of keeping a private health insurance system that means shopping for health insurance. It can be quite confusing, and consumers risk overbuying and underbuying. Listen, we all should advocate health care for all Americans. They deserve it. No one should be turned away from a hospital. No one should be given preferential treatment because of their socioeconomic status. Affordable care allowed insurance companies and pharmaceutical companies and trial lawyers at the table to negotiate this act, and as a result, it was their interest that was taken care of, and not the interests of everyday Americans. There are Americans who will tell you, who are poor, whose premium went from, let's say, $100 a month to $600 a month, and sometimes $1,000 a month. And what always happens is you make it work for a class that can always afford it, and you make it work less for classes of people that can't afford it. And what we got to do is get to a point where healthcare, you've got to remove the special interest groups and those institutions that benefit by continuing to fatten their wallet. And if you're going to make healthcare work for everyday Americans who really cannot afford it, then take those lobbyists and everybody out of it and make it work. And until the president or anybody else decide to make it a principal issue instead of a political one, we will continue to be confronted with these many complicated scenarios.
Well, just for a minute, Armstrong, I'm going to ignore your advice and bring in one of the lobbyists and one of the experts in this area. James Capretta is a fellow at the American Enterprise Institute now for 4 years. He was responsible for all healthcare, social security and welfare issues at the White House. So, James, you have quite a CV, quite experience in this area. Would you modify what you've got now, or would you literally scrap all the laws and start again?
Well, I've always been for what's called repeal and replace. So I think scrap is probably the better term. You'd have to have a very lengthy transition, though. Look, I mean, the law has been in place now going into its third year. Lots of changes have been implemented. I'd move in a very different direction with the transition. But I think some things need to be cleared up. First of all, no one has said that the estimate was provided previously about 24 million people getting insurance because of this law. Nobody's estimate is that high, including the administration's. It's much less than that. Secondly, the main thrust of the law was to move power and authority over healthcare from individuals, communities, states, and employers to the federal government. So the main beef with the Affordable Care Act is that it became a very federally run system. The replace programs have been put forward, I believe are much better because they'd be decentralized, they'd be more market-based, they actually would control costs. The notion that Obamacare has slowed down the pace of rising costs is completely untrue. It's actually added to the pressure for services and demand and therefore put costs up, not down.
But James, is there a sort of philosophical argument here whereby you just do not like the idea of central government running things? You think it's better done by private enterprise or at state level?
I think in the area of healthcare, it's absolutely important for more decentralization, more market-driven approach, more consumer control. It's quite obvious that a lot of centralized governments around the world do run their health systems centrally, and they do some things well, but a lot of times they reduce the quality of care. And the United States is a big, diverse country with a complicated political situation. Having our federal government run the entire health system for everybody in the United States is a terrible idea. And Obamacare put us not all the way there, but well down the road toward making that a reality.
But Jeffrey, as I understand it, this was an attempt by the Obama administration to do at least a step towards the National Health Service we have here in the UK, where at least everybody has a fair chance of getting the health care they need.
As somebody who has lived under two government health insurance systems in France and in England, I can tell you that they are much better than what we had before Obamacare. Infinitely better. I mean, James gives you the usual BS Republican rhetoric and twisting facts and stuff, and it's all nonsense. Repeal and replace. They've never actually said what they want to replace it with. I mean, this is utter crap from the Republicans. The fact is, this is not government health insurance by any stretch of any imagination. I wish it were. I wish they would have taken the single-payer system and turned Medicare free to everybody. That would have been great. Or say Medicare if you choose it, or go to a private insurance company, which must match the Medicare system or make it better if they want clients. Open up the state borders, allow them to solicit customers across state borders, and make it available to everyone. That would have been fun.
It is true, is it not, that the government systems have had to step in a lot more than was anticipated? The government, the central list that the federal government provides.
No. The government had to step in on the website problem. But the fact is, this is not government health insurance. Look, he says not 24 million people. There's the 24 million people figure right there. It's 24 million people will lose their health insurance, and the budget will go over by something incredible. And I saw that figure this morning. I think it's $10 billion or $100 billion. It'll cost 1 trillion dollars to repeal it. This is all nonsense by the Republicans. This week, the new governor of Kentucky was elected, and he will, as his first act, pull health insurance back from 400,000 people. That shows you the mean-spirited nonsense that the GOP is trying to do.
Armstrong, why would he do that?
Because the reason why he won, it was the will of the people. And they had an opportunity to experience Affordable Care or Obamacare for the last 3 years, and personally, through their own personal experiences, which is something that people understand, whether healthcare works or not, they didn't want it. And young people tend to be healthy and not need coverage as often as older people who are often sick. And so that was not even taken into consideration. While Jeffrey can blast the I didn't interrupt you, please. And while Jeffrey can blast the governor, he did the will of the people. And the will of the people, it's not that they want to overturn it, but they realize that it can be enhanced, it can be tweaked where it works better for everyday people, and it's just not working.
James, why would you be able to... Hang on a sec, Jeffrey. Let's get James back in on here. Do you want to reply to some of the points Jeffrey made?
Sure. First of all, it's just not true that Republicans have offered no plans to replace the Affordable Care Act. First of all, on the campaign trail, both Senator Rubio and Governor Bush have proposed very comprehensive plans that would cover just as many people with health insurance as the Affordable Care Act. Secondly, in the Congress, Representative Price, chairman of the House Budget Committee, Senators Hatch and Burr as well as Congressman Fred Upton, have all offered comprehensive plans that are the leading plans, if there were a Republican president, that would likely be the ones that would be enacted on. So it's totally false that there's no alternative. Hey, we have to do Obamacare or nothing. That's just plain wrong. Secondly, Obamacare, under the cost estimates, he says, well, 24 million more people will lose insurance. That's if nothing is put in its place. No one's talking about not fixing American healthcare. I say President Obama got one thing right, which was that in 2009, American healthcare needed to be reformed. It just didn't need to be so centrally managed under the federal government as he did it. He moved all power and authority to the Department of Health and Human Services to run how healthcare is delivered by insurance plans are offered and purchased, also how hospitals and physicians organize and try to do their business. He's put a huge amount of authority all in HHS. That's a terrible idea.
But
the United States has many,
let me put the rather
problems.
simplistic notion to you
Many
about
problems.
the pre-2000... Hang on a second. Let me just put this a rather simplistic notion about the pre-2009 state of affairs. That in a country as wealthy and as brainy and as clever as America, some people were literally dying for the lack of health care that they needed at their point of need. That was the case, wasn't it?
It's actually probably still true today. It's a big, complicated country, and there are a lot of things going on. And yes, we had a very, very flawed system, and it needed to be reformed. But that is not to say that the quality of American healthcare wasn't in many, many instances very high. In fact, leading the world. We have the best institutions. We have the most highly trained physicians. We have the ability to take care of people in ways that many other countries cannot. Now, that's not to say that other countries don't do well by the approaches that they have taken.
Okay,
but
thanks, James. Jeffrey, come back.
What the Republicans always do is they confuse the state of American medicine with health care. We may have the best medicine in the world, but we had the lousiest health care system pre-Obamacare and the Affordable Care Act. We had nothing.
Well, not
if
for
you
everybody,
could afford it,
Jeffrey.
you could
Come
get
on.
Blue Cross Blue Shield,
surely,
you could go private.
Hang on a second. If you've got a good job, if your employer pays your premiums, if you can get down the road, you can get anything fixed at any time. But it depends on being in those very fortunate circumstances, doesn't it?
Absolutely. The rich had great health care. The poor, who were dying, had none. This has given health care to 16 million people who previously didn't have it, most of whom get it at a discount or for nothing. So Armstrong's figures of $1,000, I mean, these are nightmarish stories that simply aren't true.
Armstrong?
Look, obviously, if healthcare and affordable care was working so well, it would not have been repudiated at our polls in the recent presidential election. You know, I wish the time will come where we can have reasonable discussions about these issues, especially where it impacts people with the most vital aspect of their lives, their health care. And to use these ad hominem attacks and these dismissives is just not the answer. There are flaws in affordable care, and that needs to be enhanced. We need to go back to the drawing board to find out what makes it work. It's not about whether it's on the left or on the right. We get so caught up in maligning each other. It's about people have had a chance for 3 years to embrace and understand affordable care, and affordable care has not measured up. And I will tell you, unless something changes, a year from now in the presidential election, there will be a further repudiation of affordable care.
There wasn't in 2012.
How the instruments of government work here. It strikes me this is the biggest and the most, perhaps the most embarrassing political football, because a president wants to do one thing, he or she may end up with a hostile Congress or a hostile Senate. And, you know, the politicians in Washington just seem to fight with this thing while people are seriously ill in other parts of America. It's crazy, isn't it?
Crazy, you know, and it's so unfortunate. And reasonable people should be able to come together and be reasonable instead of these attacks. What you hear with Jeffrey is no different than the gridlock you have in Congress, because everybody wants to be right. Everybody wants to protect their turf. Everybody wants to protect their special interest group. And the American people get hosed. I mean, it doesn't require brain surgery, rocket scientists to go in and say, let's tweak it here. Let's make it work better here. Let's make it work better here with Medicaid. Let's make it work better here with young people. Let's balance this out. Let's make sure that the premiums don't skyrocket. These things with intelligent people can be worked out with sound plans if we get away from our little fiefdoms and make it work.
Exactly. So, James, if you were back in the White House, if you were back in the White House next week, let alone next year, why can't you make it work? Why can't you get these politicians to sort something out that works for everyone?
Well, I think there's a big divide over the basic direction of this thing. I think there is, and you can see it in the comments have been in the last few minutes and remarks. I don't believe the United States should have a totally government-run health system. And a lot of the folks who push the Affordable Care Act, they say it's not a government-run system, but it moved down the road toward that. The government is much more involved in many aspects of the health system because of the law. And so the question is, which direction do you go? Do you have to have so much central management of insurance as well as care delivery? I mean, the Affordable Care Act is getting the government involved in how physicians and hospitals are actually doing their business, despite what Jeffrey has said. And so the question is, do you want that, or do we really want a little bit more decentralization, a little bit less federal control, but also some federal oversight to ensure people are protected and you have secure and options for consumers to choose from? I'm not against no government involvement, but I am very much against having the government run the whole thing.
James Capretta, thanks for being with us today.
Thank you.
A reminder, you can catch up with the Sky News debate on Apple TV, Roku and Catch Up, and of course at skynews.com/US. Tunisia lies in North Africa with beautiful sandy beaches on the Mediterranean Sea. Tourism was a crucial part of its growth and development. Then, earlier this year, terrorists struck twice, killing dozens of people. And at a stroke, money stopped coming into the country. Well, the Tunisian Minister of Tourism is Salma Elloumi Rekik, and she's with us now. Minister, how bad is the situation right now?
After the terrorist attacks of Bardo and Sousse, the tourism sector has been suffering a severe crisis due to a sharp drop in numbers of tourists from all European source markets. This crisis that has hit all businesses which are related to tourism, such as agriculture, handicraft and transport.
And how many of the hotels have any guests or sufficient number of guests to be able to carry out their business right now?
We close around 70 hotels, but it's due to the crisis. But we hope that we have more tourists in the near future.
Yeah, and no doubt that's affected employment in your country.
The number is very important. For example, handicraft, which is related directly to tourism sector, we have around 360,000 persons. In tourism, 400,000 people. It's very important.
Well, let me bring in and introduce you to Jeffrey and Armstrong in New York and Washington, respectively. Armstrong, this is an extraordinary turn of events, isn't it? I suppose, understandably, people are nervous to travel to North Africa right now.
Well, when you have a European bulletin suggesting to avoid the beaches in Tunisia because of a terrorist attack, the obvious conclusion is that the government of Tunisia is not doing a very good job of communicating with other European tourism agencies that they have done enough to restore confidence, to rebuild the infrastructure, and protect their citizens from going to a place that may be a terrorist threat and could jeopardize lives. Now, obviously, since that event, that has not happened. But this is really a public relations problem, and it's squarely on the tourism industry in Tunisia. They're not doing a good job. And if you cannot convince the Europeans to come back and that it's safe, look, Tunisia is not and won't be the last place where there have been terrorist attacks, where afterwards, not only did they do a good job of public relations and rebuilding the infrastructure and building the security there to reassure people that they can come back, other countries have joined together in that collaboration to say, yes, go to Tunisia. It has been rebuilt. It's better than before. It's safe. And this is what we've done. If this is the conversation we're having today, that's a direct indictment of the country and the tiny island itself.
Well, Salma Rekik, are you not telling the world what's happening there? Are you not opening yourself to new tourists?
Yes. We have communicated a lot on new safety measures put in place in all tourist area and within tourist establishment. The accredited ambassadors in Tunisia have been repeatedly invited by the government to be updated about the current situation in Tunisia. Hundreds of journalists and influence figures have visited our country during the last 4 months to witness the reality of the ground. And we have also set up a new communication strategy to showcase the new democracy and the freedom enjoyed by the Tunisian people.
OK. Jeffrey, what more should they do then to try and persuade people to go back?
Leave it to Armstrong to blame the victim. I mean, incredible nonsense. Madame, vous êtes bienvenue sur le plateau. I just said in French that the minister is welcome on the show, and she's absolutely right. They have done the PR work. But this is not a PR problem. This is a security problem. And that's where the issue lies. You cannot allow these terrorists to take control, and it has to be fought mano a mano with the terrorists. The tourism will return once people feel secure. So it's not a question of PR. The minister knows exactly what she's doing in that extent. It's simply a question of security. The same problem exists in a lot of other countries. It exists today in Paris and London. Tourists will go as long as they feel secure. They simply, in Tunisia, where I have been, and it's a beautiful country, I have spent time there, and you just need to feel secure. It's not a question of reading great reviews in some newspaper or reading bad reviews in another.
Minister?
I agree completely with you, and the security is our priority. It's very important, and we have special cooperation with Great Britain, with Germany, with United States, and European country too. And we are from Bardo. We are working together in order to implement new safety measures and to reach a level of security as in London or in Paris or in other city in Europe. And we are working very hard in order to reach this level. And we have we are implementing new measures, for example, in hotels, to secure hotels, because it's the responsibility of the owner of the hotel. The government has to secure airports, and
it should be the responsibility of the hotels to provide safety for their guests. That's true in every hotel around the world. But more particularly in this situation, in Tunisia, you have to understand that we're talking about nearly 16%, 15.5%, something like that, percent of the GDP is tied to tourism. It's a $6 billion industry, and it accounts for 250 some odd thousand jobs. This is not just some sort of a secondary thing. This is major for the Tunisian government. And Madam Minister has said that they're doing what they can in the region. It's a very difficult region to exist in. There's no tourism in Libya. There's probably no tourism in Algeria. There's very little tourism these days in Egypt because of the security problem. Tunisia is doing what it can, but part of that burden has to be the hotels. And hotels that don't comply, where guests don't feel safe, will go out of business. And the ones who will spend the money to protect their guests have a chance of surviving.
That seems, Armstrong, a little odd, isn't it? That it's down to the hotel owners to sort it all out. The government itself won't promise to look after tourists?
Let me just tell you this. I'm not politically correct today. And this is not about blaming the victims. Today, I speak as a businessman. And listen, during this past summer, when my family and I were planning to go overseas, Tunisia was one of the places we considered. As early as July, the UK government was telling people that it was not safe to go on those beaches where 38 people were killed. And so if they're telling people it's not safe, either your revenues have dried up and you can't afford to put the security measures in place, you can't afford to rebuild the infrastructure, you cannot afford to ensure people that it's safe to return. This issue is squarely on you and your government, that you have not done enough to reassure people that they can return and their lives will not be threatened and they will be safe. People are not going to places where they feel they're going to be threatened, and the government cannot protect them from people who want to do harm. So when you get your financial and tourism house in order, and the Europeans realize that your house is in order, then they will put out the bulletin forcefully that you should return to Tunisia as a vacationing place. Until that happens, it's still an indictment that you're still not doing your job. You're falling short.
Minister, you should spend more money.
Yes, sure, we are doing this. But the problem of security is not, or of terrorism, is not the problem of Tunisia. It's the problem of the region. And we have to deal with this problem with all countries around Tunisia. and even European countries, because we are just in front of Europe, and there is a special agreement we have now with country in these items, and we have to work together in order to solve the problem in this region concerning, you are speaking about terrorism.
Yeah. Salma, Elloumi, Rekik, thank you for being with us.
Thank you.
Jeffrey and Armstrong, thank you very much as well. And that's it for this edition of The Debate. You can continue watching Sky News on Apple TV, on Roku and Catch Up, and of course on skynews.com. Until next time, goodbye.